If your leg pain or sciatica keeps coming back, it's usually because the real cause was never identified or corrected. Many people are told to stretch the leg or rely on medication to manage the pain, but in many cases, the problem is coming from specific areas in the spine that continue to irritate the nerve. In this video, I'll show you how those spinal causes are properly assessed and demonstrate a few different chiropractic adjustments used to relieve the pain and correct it long term. You'll see why effective chiropractic care has to match the cause rather than follow a one-size-fits-all approach. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to the spinal problems that develop from an unlevel foundation, like anatomical short leg, spinal and pelvic misalignments, poor posture, and foot dysfunction. This channel is for people dealing with chronic pain like back pain, sciatica, neck pain, poor posture, or headaches, and are looking for real lasting relief. You'll get clear step-by-step strategies to address the root cause of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. I upload a new video every week. Leg pain, often referred to as sciatica, typically describes pain that travels from the lower back, down the back of the thigh, into the lower leg or foot. While this type of pain is commonly associated with irritation of the sciatic nerve, not all leg pain is true sciatica. One of the most commonly missed causes is spinal misalignment in the lower lumbar spine, sacrum or pelvis, where the spinal nerve exits and eventually forms the sciatic nerve. When these areas become misaligned, the nerves can become irritated or compressed. Over time, unresolved spinal misalignments can contribute to accelerated spinal decay, arthritis, and degenerative disc disease. Along with disc injuries or disc herniations, these changes can place increasing pressure on the nerve roots or sciatic nerve and lead to persistent or worsening leg pain. Additionally, dysfunction of the sacroiliac joint can cause referral pain that closely mimics sciatica, often traveling to the back of the thigh but stopping above the knee. Because leg pain can come from multiple sources, failing to identify and correct the true cause often leads to symptoms that return, sometimes more intensely than before. Now that you understand both how and why leg pain can come from several different sources, the next step is figuring out which one applies to you. This is where proper assessment matters. Rather than guessing or treating every case the same, we use a focused and structured process to determine where the nerve is actually being irritated, what's contributing to it, and whether the issue is coming from the spine, the SI joints, or a combination of factors. This allows the care to be specific, efficient, and targeted to the actual problem. After doing a thorough health history, one of the first things we'll check is posture. The reason posture is important is posture gives an idea where the big stress is in the spine. Just like if you're looking at a house and you stand beside it and look up, if the walls don't look straight and the roof line doesn't look even, you know there's something major going on with that house. One of the first things you'd start to check is the foundation. So this is the reason we assess for posture first. Posture will tell us if the pelvis looks level, rotated, twisted, what the spine looks like, whether it's straight up and down or whether it has curves or what are called translations. Also what the hips and the legs look like. So that's one of the first steps we'll take. After we're done assessing posture, then we'll go ahead and start looking at more functional patterns like range of motion, the neurology tests, palpation, and what the spine actually is moving like. Once we've assessed posture, then we'll get into more functional tests. This will involve things like range of motion. With range of motion, what we're looking for is how the movements of different aspects of the spine function. So this will help us to determine if the problem is more of a spinal issue, possibly a pelvis issue, or whether it seems to be extending more further down into the legs. With this assessment, what we'll look at is movement of the spine. So we'll look at things like flexion, extension, rotation, and lateral bending. This will be done in a few different ways, both active and passive. One of the things this really tells us is how the spine's moving and where maybe specific problems are occurring. The other thing this will tell us is the chronicity of the problem. Sometimes even though the pain has just started, the problem may have been developing over years. You'll see certain patterns like muscle tightness more significantly on one side than the other. That's how we can determine whether this is an acute problem that's just started and just occurred, or something that's maybe been going on for weeks, months, or even years. Assessing for strength, sensation, and reflexes will help us determine where the problem may be occurring. Certain muscle patterns and certain sensation patterns will be affected depending on how the spine or sciatic nerve is affected. Just like in your house, where nerves or wires in that case run from certain breakers out to different parts of the house, your spine acts in the same manner. If the lower spine is affected, certain nerve roots will go to certain muscle groups. If the sciatic nerve is affected, other muscle groups may be affected. By doing this determination, we can actually figure out where exactly along the nerve root the problem is occurring. The other thing is comparing side to side. You can make determinations of what exactly may be affected. By assessing for muscle and joint mobility in the lower legs and pelvis, you can get a very clear determination of what exactly is happening, whether it's true sciatica or nerve root involvement. By checking for specific range of motion in the hips, the pelvis, and the lower spine on both the affected and unaffected sides, you can get a clear determination of where the nerve or nerve roots may specifically be affected. This also helps you determine whether muscle patterns have been there for a short period of time or possibly much longer, and what kind of stretches and strengthening exercises would be beneficial to alleviate the problem. Palpation of the spine is the final and probably most critical component of the examination. Once we've assessed posture, we've looked at range of motion, we've checked muscles and reflexes in the nervous system for how it's functioning, palpation is the final component to really piece it all together and determine exactly what we need to do. In palpating and assessing the spine, one of the things we'll look for is leg length. This determines whether the pelvis maybe has a twist or pull or is rotated one way or the other. That again helps us to determine where exactly the cause of the problem may be coming from. It also may help us determine if there's an anatomical leg length difference, which we would have seen a little bit on posture and range of motion already. From here, we can start to determine whether that may need to be corrected as well. With the rest of the palpatory exam, what we're actually assessing for is movement in through the pelvis, the tailbone, and the lower spine, even up into the thoracic spine. This helps us to determine if this is more of an acute issue or a chronic issue where it's been there for weeks, months, or years. It also helps us determine where exactly the initial cause of the problem is. We can address the symptoms and that so the person starts to feel better, but you really want to focus on figuring out what's causing this problem in the first place so that can be dealt with. What I want to do next is demonstrate some of the chiropractic adjustment techniques commonly used with patients experiencing leg pain or sciatica. There's an important distinction to make before showing these examples. These are not adjustments for leg pain itself. They are adjustments designed to correct the underlying cause of the leg pain. That cause can vary from person to person. In some cases, it may involve the misaligned vertebrae in the lower lumbar spine, such as at L4 or L5, where the spinal nerves exit and contribute to sciatic nerve. In other cases, the source may be a misalignment of the sacrum or pelvis, or long-standing postural stress that alters how the spine and joints are loaded. This is why a thorough exam is critical. Without identifying the cause, the adjustment cannot be specific. With that in mind, the following are examples of chiropractic adjustments that I have used with patients experiencing leg pain and sciatica, helping them to achieve relief and, in many cases, lasting resolution of their symptoms. Occasionally, when patients come into the office with a sciatica or low back side of pain, and the pain is so severe they can't lie down comfortably for an adjustment. So in those cases, what we can do is we can begin the adjustment process with them sitting up. In this case, what we'll do sometimes is we'll use our hands to deliver subtle adjustments, or if even that is too difficult for the bear right away, we can use small instruments that give a very focused adjustment. There's mechanical ones, and there's also electronic instruments that we can use. These give a small, very focused adjustment in a certain area to get the function back in the spine. The goal of using these is to get the spine back into some normal type of movement to decrease inflammation, get nerve function back to normal, and get them out of pain quickly. Another type of adjustment we use is what's called drop table adjusting. This is done if the patient's comfortable enough to lay on the table. If they can get her to this position, what we can then do is use the segments of the table that pop up or pop an inch and drop to deliver a very precise, quick, and comfortable adjustment. Although the table makes a lot of noise, this is a very gentle way of adjusting. What we'll do is have the person relax, lying face down, do the assessment that we need to determine what exactly needs the adjustment, and then using the table, we can deliver some very focused adjustments in an area that needs the correction. By doing this, the adjustment will help to restore joint motion, take pressure off the nerve, and help to decrease inflammation. This acts all together generally to help the person start to feel and function better quickly. The third type of adjustment I want to show you, which is probably the most common associated adjustment people think about when they think about chiropractic, is manual adjustments. With this, what we do is we'll adjust the spine, the sacrum, or the pelvis, depending on what we've assessed, with our hands. With this adjustment, what we'll generally do is have the patient lie down and adjust in this manner. Now, this again can only be done if the patient's comfortable enough to get into a side posturing position. With the patient positioned on their side, what we'll do is we'll line them up so that we can stabilize the body all around the segment that needs adjusting. Once we have them in this position, we'll tension the joint so we have the exact spot we need ready to be adjusted. And from there, take a breath in, all out. We'll deliver the adjustment. Again, the goal of this is the same as the previous ones, to restore normal spinal function, get the movement corrected, which will help to decrease inflammation, restore nerve function, and hopefully help to minimize the pain quickly. Leg pain and sciatica don't have to be something you just live with. When the underlying cause is identified and corrected, lasting relief is possible. That's exactly why we do thorough, proper assessment and targeted chiropractic adjustments. Now it's your turn. If you've dealt with leg pain or sciatica, share your experience in the comments. What have you tried so far? What helped? What didn't work? Drop a comment and let me know. If you found value in this video, please like it and share it with someone who may be dealing with similar symptoms. And if you've been struggling with leg pain for a while, consider looking for a chiropractor in your area. Proper assessment and care could be the missing piece. Remember to subscribe, and if you want real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do next. One often overlooked cause of sciatica and leg pain is an anatomical leg length discrepancy, which can place extra stress on the lower lumbar discs and spinal nerve roots. If you've been told that you have a true short leg, watch this video next, how to fix a true leg length discrepancy.